Welcome. Take It Up with Jessica Lee. I'm here with Ateret Haselkorn, who is the Director of Strategic Marketing at Vocera Communications. Hi, Ateret.
Hello.
Welcome to the show.
Thank you.
I'm here to talk with you about the healthcare industry and the innovation that you're bringing. Vocera is providing a platform of communication tools for the hospitals and primarily to help the clinicians do a better job, providing a better experience, right?
That's correct. Vocera is a global company headquartered in San Jose, California, and we operate with the mission of making things simpler and easier for doctors and nurses and the patients who they take care of.
Okay.
So I'll give you an example. An ambulance driver who's transporting a car accident victim to a hospital would use our platform in order to communicate with the appropriate nurse at the trauma center where they're headed.
Mm-hmm.
He wouldn't have to know her name. He would be able to quickly connect with her using the Vocera platform, and that nurse in turn would very easily be able to connect with the trauma team, the doctors and the nurses who need to know who's coming in, what the situation is, what medications they've been given on the ambulance ride on the way over. All in all, I'd say that Vocera reduces chaos.
Mm-hmm.
It reduces the mental burden, especially on nurses and on their memory. And it replaces things like pagers, sorting through paper charts, even shouting down the hallway to take better care of patients from the get-go.
That's great value. Now, you have a product here that I wanted to highlight. It's a great communication device. So it's a software platform with hardware. So this is where the technology can help the nurse, give her or him the hands to do their work, but at the same time be able to communicate and get alerts to information that's critical to taking care of the patients.
That's absolutely right. And not only that, the nurse or clinician wearing our smart badge can decide which alerts and alarms should receive priority. So nurses especially are bombarded constantly with noise. I don't know if you've spent time in a hospital. I hope that you have not. But if you have, you might have noticed the constant beeping.
Yes.
That's bad. I mean, that causes what's called alarm fatigue, which means that a nurse or a doctor would be less likely to recognize and then respond to something very important. You know, Mrs. Jones in room 301 really needs to use the bathroom is important, not as important as something more critical, like a shift in a vital sign.
Mm-hmm.
So the alert would be prioritized and it would be sent to the person wearing this smart badge who could respond to it. They could use texting in a way that is private and secure to respond. They could connect with members of their team to collaborate with them. As you said, the closer a nurse is to a patient, the more she is likely to need to have her hands free.
Mm-hmm.
So if I'm a nurse and I'm near a patient who's becoming very sick, I might put my hands on the patient to comfort them and then use my voice to say, I need a team to support me in room 301, or I need Nurse Jennifer,
Mm-hmm.
or I need environmental services to help me clean up.
And it recognizes your voice because you've got a patent technology that only picks up that nurse's voice as opposed to someone else talking nearby. Right?
There's a cone of sound here that we can't see.
That's cool.
And if the nurse wants more privacy, she or he can wear an earpiece and speak into a mouthpiece as well.
Now talk about the panic button because I think that's quite innovative.
Well, thank you. The panic button is very popular. It is a dedicated button that fortunately or unfortunately helps a nurse page security and whoever else he or she would like to notify that they are in danger. There is a growing issue in healthcare where people who take care of the sick encounter hostility. They're placed in dangerous situations. Many times it's a mental health problem that might cause a patient to strike out at a nurse. And instead of crying for help or having to find a button in a room, with the push of a button, that nurse can notify the people who she needs to help keep her safe, and they'll know who she is, where she is, and that she needs help.
Okay, that's awesome. Now, let's turn to marketing because you've done a tremendous amount of research in order to identify the sweet spots for the company, the type of hospitals to go after, the personas to go after. Talk to us about the research aspect. I think it's fascinating what you've done.
Thank you. So as Director of Strategic Marketing, one of my big responsibilities is to keep track of trends in healthcare and make sure that our sales and marketing strategies are ahead of the curve. In healthcare, I won't bore you with all the details, but over the past 10 years, we've seen a tremendous amount of mergers and acquisitions. So to give you an example, seeing a standalone community hospital is very rare these days. What you're much more likely to see is a large corporation like a Kaiser Permanente or Ascension Health that owns under one corporate roof tens to hundreds of hospitals. And because of that, we can no longer sell the way we want to at the departmental level. We used to speak to IT managers. We used to speak to maybe even a nursing leader in, say, labor and delivery. But now when we want to communicate the value of Vocera, we speak to steering committees and we speak to very high-level individuals, sometimes at the C-suite of healthcare, like a chief nursing officer or a chief medical information officer. So what does that mean? We had to really dramatically shift. The first thing that we did was segment the market. The second thing we did was prioritize it. And the third thing that we did was partner with our sales teams to ensure that they would be successful in reaching those targets of interest.
You had to do a lot of focus groups, a lot of surveys.
I had to do a lot of research. So, I mean, if I start back here, the first thing that we did was we identified 6 very common archetypes of hospitals in the healthcare industry, like academic medical centers. Think of teaching hospitals that are known for their research, like Harvard, for example. Or think of a huge integrated delivery network like Kaiser Permanente that might also sell an insurance product. And we surveyed them. We surveyed over 170 organizations, and we asked them 2 things. The first is, how likely are you to buy a product like the Vocera platform? And the second thing was, why? And what we discovered was very interesting. What we discovered was that the appetite to buy, or the propensity to go out and buy something like the Vocera platform, did not vary substantially between those different types of hospitals. But the reason they wanted to buy it did. Some hospitals were very interested in improving communication speed. Some wanted to standardize operations, and some were very fixed on the idea of doctor and nurse well-being, decreasing the burden on their memory that they needed to handle in order to take care of a patient. You know, doctors and nurses fundamentally go into healthcare because they want to take care of people. They don't go into healthcare because they want to play with a computer.
Yes.
So that is one thing that we help with, and that's actually one of the reasons that our potential buyers were interested in a solution like ours.
Yeah, so if the doctors and the nurses are healthier mentally, then they'll be able to provide better quality of care to the patients.
Yes.
And that could also reduce a lot of mistakes and improve the bottom line for the hospital.
Absolutely. You should come work for Vocera. You know, studies have shown that the opposite is true, that the worse the mental health of the clinician, the more likely they are to make mistakes. And those mistakes take a toll on well-being of patients. It's also extremely expensive. And reducing that level of burnout is one of our key initiatives as a company. So what did we do with the research we'd done so far? We changed our messaging in order to take into account the type of hospital that we were targeting. And then we took a targeted approach to sales. We identified a sweet spot of over 100 strategic accounts and said, this is who we would like to go after next year. But it's not that simple. I mean, research can be fascinating, but also complicated. And we pulled data in from multiple databases in order to look at things like win-loss ratios, to look at patient satisfaction scores, which are publicly reported, to look at what was going on in different competitive areas in order to identify that sweet spot. And then the Senior Vice President of Sales and Services for Vocera requested that marketing provide what he called air cover for his team in approaching those accounts. And in a nutshell, what that meant was we had to enable the sales teams to speak at a strategic level. When someone in sales speaks at the departmental level, it's a different conversation than when you're speaking with, say, a chief information officer for a hospital. Department level, it's important. They'll ask you about how does it work and what does it do and how much does it cost. We'll get all of that at the higher level, but that person will also be interested in how does this improve the overall quality of care, and specifically, how will it improve our ability to prevent readmissions to our hospital. When we've treated someone and discharged them, we don't want them to come back with the same problem. That means we haven't done a good job, and we're frankly going to be reimbursed less by insurance companies. So our sales team had to be prepared to host a high-level strategic conversation about things like hospital market share, quality of care, staff burnout. And we had to do a lot of additional research in order to produce tools to give to them to do that.
Tell me a little bit about the sales team. I mean, how do you help them to get in front of clients and be effective when they're there?
We developed practical, to-the-point tools that were low-tech and high-tech. So low-tech, we developed flashcards where we explained the mindset of the healthcare C-suite by persona. For example, Chief Medical Information Officer was given a tagline, "This is a clinician learning to be a businessman." We provided the sales team with key points that he or she would want to hear about, how to handle difficult questions, and what case studies to point to. We printed them out on laminated cards. We gave them a punch in the corner with a little clip, and we put them into the pocket of the salesperson, and they loved them. We also generated podcasts. So we interviewed customers about their roles. And one nice thing about Vocera is we have like titles. So a hospital has a chief nursing officer. Vocera also has a chief nursing officer. And we interviewed our own chief nursing officer. We recorded her, and we generated a 10-minute long podcast that a member of the field could listen to, say, as they were driving up to a meeting.
Very cool.
Thanks.
You've seen the marketing effort contributing to the revenue increase for Vocera.
We have. Of course, I work in a team, and marketing is very collaborative, so we can't claim credit for all outcomes. But Vocera is a publicly traded company, and our revenue fourth quarter of 2019 was $49.7 million. 1 year earlier, it was less. It was $48.9 million. And what I can also share with you is that our marketing-sourced pipeline is 40% of our overall pipeline.
Very good.
Thank you.
I like that you share a lot about the company technologies, innovation, and what it took for you to identify the sweet spots and the messaging, the changes to make an impact. What I also like is the fact that you have worked with a lot of female leaders.
Yes,
and given that it is International Women's Day approaching March 8th, I wanted to get your thoughts on the progress for women in tech.
Well, I'm flattered at the question. I have had the good fortune of working for many talented women. I started working in healthcare in 2003, and I've reported to women who have reported to women who have reported to women. And one thing that I have really appreciated through their mentorship, which has always been very dedicated and professional, is the direct feedback that they have given me. So I don't know about you, but sometimes I like to Google business articles and advice for women, and sometimes the advice is beautiful but not practical. Appreciate yourself, follow your dreams, which is important and lovely.
That's an inspirational phrase.
Exactly, inspirational phrases. But the feedback that I've been fortunate enough to receive from the women who I've worked with has been direct. It has been change the order of your messaging to put financial results first. Stand up straighter. Don't be afraid to ask the question that's tugging at the back of your mind. Don't be afraid to voice what is bothering you, because chances are everyone else is thinking the same thing. And what's more, you need to follow your instincts as a business leader. Research is important, and we should always look at the data, but in the end, it's really your mind, I'd say.
Right.
That
the collective experience and also the data. Right?
Yes, exactly.
Okay. Great.
Exactly.
Well, it's been a wonderful conversation. Thanks for being on the show to share your thoughts and best practices with us, Ateret.
Thank you for having me.
There you have it. Take it up with Jessica Lee, Ateret Haselkorn from Vocera Communications.